The consequences of a snake bite can vary widely, ranging from localized reactions to severe and potentially life-threatening complications. The severity of these effects is influenced by several factors, including the species of snake involved, the location of the bite on the body, the promptness of medical intervention, and the overall health of the individual affected. Members of the public, particularly those who live and work in areas near where the Furdula snake is known to inhabit, are encouraged to recognize the symptoms and signs of a snake bite. These may include immediate pain and swelling at the site of the bite, as well as nausea, vomiting, and systemic reactions such as difficulty breathing and paralysis.
You might be walking in your garden or whatnot, and you might just feel the sting. You might not see what bit you. It might be small, it might be big, you might not be able to tell it was a snake. However, if you notice swelling in the area, you notice that it's really a burning sensation, a very, very, very sensitive sensation to it. It starts to turn blue. Also monitor your swelling as well. Try to keep the part of the body that was bitten as still as possible. So if it's your arm, you could just put a sling and swab and just have that arm in a neutral position, a position of function as well, right? If it's your leg, we advise persons, if you are able to, if you have the training, just splint the leg and allow someone to carry it, because that's what we are going to do. And the main thing is to seek help as quickly as possible, all right? Even stuff like sucking out the poison, do not try that, okay? That does not help.
Medical professionals emphasize the importance of seeking medical attention for snake bites, rather than relying on home remedies or treatments.
We respond to calls and we get a lot of persons who use the home remedies like pouring alcohol, G's, turpentine, kerosene on bites, and we need people to refrain from doing those things, because the main thing I would need persons to do is to try to get help as quickly as possible, try to get to the hospital as quickly as possible, and that's where we come in. We advise persons not to walk, because when you walk, muscles activate and muscles need blood to go through them, so it allows for the venom to travel through the muscles a lot faster. All right? We advise persons not to try to cut it. Some persons have tried cutting the wound to try to bleed it out. That does not help you. All right? We advise persons not to put alcohol, not to tie it, especially the tying. A lot of persons tie with a piece of cloth, what's called a tourniquet, and all they do is compartmentalize what happens with the venom. So they cut off the blood supply, and then the venom stays in one part of the body, and it causes so much damage to that part of the body that it is often amputated, or that part of the body is no longer being able to use. So it's stuck in a position that is actually not functional. All right? So you advise persons, if you have help, I have someone carry you to a safe place with the ambulance, or get private transportation if it's quicker. That way is quicker for you.
Snakebite management has been included as the latest service under UHC. Chief Medical Officer Dr. Sharon Belmont George emphasized that if someone is bitten, they should reach the nearest hospital, either the St. Jude Hospital or Owen King EU Hospital, ideally within 4 hours for treatment.
These facilities have the necessary support services, including ICU, to ensure safe and complete management of snake bites. This reduces the possibility of complications with improved clinical outcomes. On arrival at the hospital, a full review is done to evaluate the symptoms, monitor the vital signs, and ensure full blood work is done, including a complete blood count, kidney and liver function tests, and coagulation studies. Medication to prevent allergic reactions is given, as the antivenom may cause severe allergies. Early supportive care includes intravenous fluids, pain management, antibiotic administration to reduce infection, tetanus toxoid, and localized wound care. Antivenom is administered intravenously under medical supervision.
The snake bite management service also includes outpatient clinic review and physiotherapy. For the DBS News World, Zane Romulus reporting.